Good afternoon, everybody, and welcome to this session from Ardens on patient recall systems. My name is Sarah Warren, and I'm Head of Development working with Ardens. We're going to, first of all, give you an outline of what Ardens is, for those of you who don't know. It's a clinical decision support and workflow efficiency solution, covering all the different elements shown on the slide there. We've got clinical templates, data quality reports and alerts, patient recall systems, which is what we're covering today, locally commissioned services module, clinical safety alerts and reports, searches and reporting, integrated links to local pathways and guidelines, and fully managed local referral forms. So I'll give you where you can find out more information at the end if you don't already, if you're not already familiar with Ardens. But today we're covering off recall systems. We've now got 2 recall systems, and they both complement each other. Many people ask if they need to use one or the other, but no, I always recommend that you would use both of them, because the chronic disease month of birth recall system is designed for your QOF conditions as an annual recall, and your diary recall is for your interim and ad hoc follow-ups. The asthmatic who needs a 3-month review after their annual review because you've started them on new medication, or a blood test that needs repeating. So the two are complementary to each other. So I'm going to dive straight into EMIS. So now we're at the mercy of whether EMIS is going to hold up for this. Hopefully it will. First of all, the QOF recall. I'm only going to touch lightly on this. It's quite a complex system with lots to it, and we've got a webinar on it that you can that you can watch. That's at www.ardens.live/recall-webinar, and it goes through the whole webinar the whole system in great detail. But the way it works is it's based on QOF registers, and it's based on month of birth, and it's aimed to streamline your recalls so that you're bringing each patient in just once a year for a review, or at least you're inviting them once a year for the review. It's designed to be able to be run very easily on a monthly basis. It's designed to be able to be delegated to somebody who is just able to run the searches. They don't need to understand searches, they just need to be able to run them. And you invite them, the patients, and the idea is that you would invite them for a fairly generic invitation. Your annual review is now due. You then need to code the patients. So we have invitation searches for first invites and second invites, and we have coding searches for first and second. And the coding means that it ensures that you code them for the correct conditions. So if a patient's got asthma, CHD and diabetes, you want to add a code for each of those conditions. Because what happens is when the patient rings up saying, I've had this text message saying my annual review is now due, receptionists run an F12, which pops up on the screen. Oh no, it's not going to work for that patient because that patient doesn't have any conditions. Get my patients mixed up. It comes up telling you what conditions the patient is needing to book a review for, and it means then the practice can book that patient according to their practice protocols, according to their nurse skill set, and so on. It means you can manage the patients the way you want to. So the searches at top level are basic and simple. You run them every month, bring in the patients according to month of birth. But there are many other searches available. Detailed review searches goes into a lot more detail to try and cover off lots of different eventualities to help practices to really make the most of individual patient contacts. It works very very closely with our multi-morbidity template as well, which is a really useful template that brings up a page of a template per chronic disease that the patient has, and enables you to make sure that you're ticking all the relevant boxes for that patient at each visit. Again, trying to maximise that individual patient visit to the practice, which is especially relevant at the moment. So that system is available to customers on request if you've not already got it in your system. We are deploying it to everybody, we're rolling it out to everybody, but if you feel it's something you'd like to get going with sooner rather than later, then please do get in touch with us, and we can look at getting that deployed to you sooner rather than later. So I'm going to move on to diary and spend a bit more time on the diary system, because it's the more complex of the two, if you like. It's a really clever system designed to make the most of EMIS's diary, to enable practices to safety net patients, to enable practices to know that they can put something into the patient record that will stop that patient from slipping through the net. So whether that be a PSA blood test that needs to be repeated, and yes, the patient might leave the practice making an appointment on their way out, but we know full well that appointment might get cancelled, and then the patient could well be lost to follow up. Or it's a diabetic who needs an interim HbA1c blood test, you can diarise that. or it's a patient who needs a repeat B12 injection. You can diarise that. So the system is integrated throughout our toolkit. So I mentioned B12 injection. Now, if you were a nurse using the injections template and were administering a B12 injection, then you can diarise the next one on that same page. The same for any of the administered medications. Wound management, if you wanted to diarise follow-up wound care, you can do that on the wound management template. But we also do have one all-encompassing diary recall template. Now, I just must say, what I'm about to show you is our brand new diary recall update. So it is just a refresh of the current system. It's not drastically new, but what it does do is include many more items. We've had lots of requests to include things like CRP, MGUS, hearing test, mammogram. So we've included a lot of new things in this most recent update, and that's the update I'm going to show you, which is being released in about 2 weeks' time. All customers have this on their system at the moment in the older version, which is very, very similar, works almost identically, but doesn't have quite as many things included. So this template, the first page is a summary of what the patient currently has outstanding on their diary. So as we can see, this patient's got a fair few things outstanding. You've got on the right hand side, you've got the diary entry in their record, and below it you've got the latest one of that thing. So here we've got diary entry May 2021 for a chest x-ray. Their most recent chest x-ray was done on 22nd of April 2020. So that information is just there for reference. The following pages can be used to enter diary entries. So for example, let's find one without one in. Let's choose GNRH, for example. You tick the box for to enter the diary date, and then you can put in press return. It diarises it for 4 months. Now, I would suggest always that you probably wouldn't use the medication administration page of this template to add diary entries, because that would be done on the injections template. The ones you would use are the investigations, both investigations other and investigations bloods. So again, on here, you would diarise the appropriate investigations. So you've just done a Doppler and it wants to be repeated in 12 months' time. And EMIS is going to freeze on me now. There we go, diarise it for 6 months' time, say, and that would put the diary entry onto the patient's record. So what happens to that diary entry now? Several things. So we have created a cough box alert. So if I'm going to do this all through test run, apologies, but it's the one way I can be sure that we can show you everything. So you can see down here in the cough box, these are the elements that are due within the next 4 weeks or overdue for this patient. So when the patient makes contact with the practice, the cough box will pop up automatically, telling you what's due. When a patient rings to book an appointment with a receptionist, then they will get a box. I wonder if this is going to, yeah. So they will get a box to tell them what it is that this patient is due. And it will enable them then to book an appointment at this time. So they can choose book an appointment, create a task, or check for results that have come in after diary dates. That's quite a useful one. It may not work on this patient. No, it's not going to. I need to switch back. That's why I had Postman Pat up. Switch back to Peter Pan even. Let's try Peter Pan. So if no, not that one. Test run, and we see the box comes up. Now this poor patient's got everything going on. This box would not usually be this big, but I want to check for results that have come in after the diary dates. And it's telling me that, oh yes, he's had some things that look like they've been done since the diary entry. And so yeah, I want to go and complete one. So I'm going to choose complete. And again, it's just a reminder, the different things that I could complete. I'm going to choose colonoscopy here. That's under the investigations other. So let's go investigations other. And I can complete the diary entry for colonoscopy. And that will be that done. So obviously most patients don't have that much in their diaries, so it's not such a problem. So the patient's made contact with the practice, so you've had the pop-ups to prompt you to make those appointments. We've also got a really comprehensive suite of searches that go alongside this, because a lot of the time the whole point is it's safety netting. The patient doesn't make contact with the practice, and therefore you need to try and catch them. So we've got searches that break everything down in every which way you might want, really. You can either look at everything all at once, or you can look at the different individual items. So if you just wanted to follow up on HbA1c diary entries, for example, going into the diary entry searches for HbA1c, it breaks them down by those who are due in the next month. So if you did want to be proactive in calling these patients, you could do, or you could look at the diary entries overdue by up to a month or overdue by more than a month. And note here, there's a report under each one. I haven't got results in here because this is a test system, but what this shows you is the diary entry. It will show you when the last HbA1c test was recorded, and it will show you whether the patient has an appointment. Thus, you're able to score through quite a lot of patients without needing to worry about recalling them, but it does enable you to safety net them if they would otherwise be going to get missed. So that is the way the diary system works. We're also at the moment developing a cancer safety netting system, which also uses the diary entry to do something very, very similar. So the cancer safety netting will use pop-ups in the same way as the diary system to alert you to patients who have had a referral for a 2-week wait and perhaps haven't had that result come back. So the two systems again complement each other, work in a very similar way, using the available pop-ups in the QoF box to show us what is due for the patient.
So we had a question just come through. Going back to the diary system. Sorry, it's Miles Cross speaking. One of the GPs who works at Ardens. The question was, can we have a look at what the diary system, what the template allows you to record as diary entries, because it has a number of different pages on the left-hand side, and I'm not sure you may have gone through that, but I'm not sure, it was a bit quick. Yeah,
fair enough. No, good point. I didn't go through it all. So just as I say, these are the ones that are coming. So there's about 15 less that are available in the template at the moment, just for those customers who are aware of what they've got currently. So medication administration covers off B12, denosumab, GnRH, HRT, testosterone, neuroleptics, pessary review or change, and vitamin D injection. The most valuable, as I say, I think, are the investigations one in this context. So BP, chest X-ray, colonoscopy, DEXA, Doppler, ECG, echo, hearing test, mammogram, OGD, spirometry, and ultrasound. Bloods, CA125, calcium, cholesterol, CRP, ESR, fasting glucose, FBC, HbA1c, LFT, lithium, MGUS, PSA, renal, TSH, and warfarin monitoring. Interim follow-up. So it's interesting, the system doesn't really cater for annual reviews, because we really would prefer that people use a month of birth annual review system, but we do allow for the interim reviews, including the depression interim review, which was one I was asked just yesterday, did we include it? So you can see most of the diseases, plus DOAC monitoring, plus a generic care plan review, plus high-risk anti-rheumatic drug monitoring, NHS health checks, and smears, as well as wound care, in addition to the QoF conditions. And then contraception is just as you would expect: injection, IUD, IUS, oral contraception, and implant.
Thanks, Sarah. Another question came in while you were doing that, and I think we've got time to answer this one. It's a really good question, actually. Someone's asked about housekeeping, and my comment I'm typing out to reply to is saying you can use the template straight away, but you must do housekeeping before you start turning on the alerts. But I'll leave you to elaborate on that.
Yeah, absolutely. So if we start quickly with the housekeeping before we start, so what everyone knows that EMIS diaries, EMIS patient record diaries are a mess. Historically, there's all sorts of rubbish in there. We only care about things that have happened in the past 12 months. If it's happened before that, we're kind of suggest that you might want to disregard it. So what you want to do is review. We've got two suites of searches, one that looks at everything that will cause pop-ups to come up and that will take part in our system, if you like, because it's one of the codes that we've elected to use in our system. And therefore you want to review those, because you might get some extraneous pop-ups that don't mean anything if you haven't just double checked those. And we've got all non-Ardens diary entries. So those are the ones that we don't use in our system, that you may have been using historically as a practice, and it may be a clinical risk if you don't switch them over to using one of ours and someone's expecting a pop-up to happen. So it's an opportunity to review those. So we've tried to break them down as neatly as possible. Ongoing housekeeping, there's a chance, I think that's partly an administrative job to make sure that things have been completed. If you run the safety netting searches, or the diary entry searches, and it looks as though a thing has been done, then somebody could go in and complete the diary entry. Every time you save a patient record, you come up with this completer. So every time you save a patient record, it will check the record to see if it looks as though there's a diary entry with a subsequent thing having been done. So the example I used earlier was colonoscopy. There's a diary entry for colonoscopy. It looks as though there's been a colonoscopy done recently, in which case you may then want to go and complete the diary entry, which you could do here. However, if it was, say, for Depo-Provera and you actually wanted to move the diary entry on, then what I would do here would be to use this option, check, add or edit an Ardens diary entry. And this would launch the template, which may not work on here at the moment because it's in our test system, but it would launch the, there we go, it will launch the template, and you can then go in and move that diary entry on by ticking in the box and putting in the appropriate diary entry. That will automatically cancel out the old one and move it on to the new date. Hopefully that covers off that housekeeping. We have got a webinar on this as well, and actually it's what we suggest to customers wanting to use this system, that they watch the webinar and look at the resources online, and then we're more than happy to organise some training with you to kind of, it's more of a Q&A, it's more kind of, let's work out how this will work for your practice, or what the pitfalls or the things to consider are for your practice, and how you might want to start using it and integrate it into your way of working. So that's something that's that we can support you with. So I think we're just about out of time, so I just want to leave you with that slide. If you're not familiar with Ardens, it's worth going to www.ardens.live/webinar. We've got a pre-recorded webinar there, which is just an overview of the whole toolkit. If you're not already a member, it's worth joining our Facebook group. There's lots of chat on there, both queries being answered, but also chat between customers, hints and tips and that sort of thing. For existing customers who want to download any of our new resources that are available to download, then please visit our portal. And if you're interested, if you haven't used Ardens before and interested in a free trial, then at www.ardens.live/trial you can sign up for a free trial of Ardens for 3 months. And I think I've time. So
one more thing, Sarah, would you mind just putting it up on a browser, ardens.live/webinars with an S at the end. This is a new page we created earlier this week, and what it does is summarise all of the webinars for Ardens, including the recall system ones, in a nicely usable format. So it might be worth looking at those ones. The diary recall ones on there at the top in the middle there, as is the recall one on the right hand side.
Brilliant, thank you. So I think that certainly we've run slightly over time, so I guess that was it. Any further questions, please do put them into the chat. Otherwise, thank you very much.